everyone, welcome back. Today I'm talking about Nexplanon side effects and how to manage them. This has been a much requested topic, so let's get started. So today we're going to talk about Nexplanon, and it's a form of birth control that is super duper effective. It's what we call a long-acting reversible contraceptive, which means it's good for a really long time, but it's also reversible. And I've already covered some of it in some other TikToks here, so I'm just going to link up to the card there. And as always, I'm going to have references and resources in the show notes. And for this topic particularly, the resources that I've got down there I think are really helpful. So scroll on down there and see if those might help you out. Okay, so quick rundown on what Nexplanon is. It is a little rod-shaped device that's about 4 centimeters big, goes in the arm, kind of under the skin right there. It's a quick office procedure that we do, and we numb the skin so you don't feel it. And it's good for 3 years. Now, it's FDA approved in the United States for 3 years, but it has been shown to work up to 5 years. I'm just going to say if you think that you want to use it longer than 3 years, talk with your doctor first about that. How effective is it? 99.95% effective, so pretty darn awesome. It works by blocking ovulation, so you don't release an egg, and it also thickens the cervical mucus, so sperm can't get up there to meet the egg if one was to be released. And what's great about it is it's set it and forget it. There's not anything that you have to do every day. That's really awesome. That said, there are some side effects. And if you ever talk to a doctor or a midwife or a healthcare provider and they say that some kind of birth control doesn't have any kind of side effects, everything has side effects, even pregnancy. So right now I want to go through the top side effects that you can see with Nexplanon and what to do to make them better. The number one thing that I hear and that you all have asked me is, what do I do about this bleeding? So let's break down what bleeding you might expect and what we can do to fix it. So the most common side effect with Nexplanon is irregular bleeding, and that is even more common in the first 6 to 12 months of use, meaning that you might have some spotting or irregular bleeding in the beginning, and then it gets a little better over time. So here's some statistics. 20% of people who get a Nexplanon will have no period, and we'll talk more about that soon. About 34% will have occasional bleeding or spotting, 7% have frequent bleeding or spotting, and 18% have prolonged bleeding, which means kind of like constant bleeding, which, yeah, that's not fun. So that means 59% of Nexplanon users have some kind of bleeding, and bleeding changes when they've had a Nexplanon placed. And when I counsel people, that's the first thing I talk about, because if you're somebody who has to know exactly when your bleeding or your scheduled withdrawal bleed is going to be, or you're somebody who wants absolutely no bleeding, this method is not for you. So what do we do if you call us and say, I'm having some spotting and some bleeding and I really need to do something about it? The first thing we need to do is make sure it's not from something else. So all that bleeds is not related to your birth control. It could be a polyp or a little growth on the cervix. It could be an infection. There's just different reasons that you could bleed. So it's important that we just get some more information first. Then there are some treatments if we determine it is related to your Nexplanon. The first thing we often do is we try something like NSAIDs, like Ibuprofen, and we'll tell you to take it for about 5 to 7 days. And that can actually help decrease the number of days that you spot or bleed. You might be thinking, well, I can't take that every day. That's not good for me. What do I do? You're right, it's really a short-term treatment. So you might need to do it here and there, but you're right, you don't want to do that every day. Another treatment is that we can try birth control pills or estrogen. You might be thinking, I'm already on a form of birth control. Why are you trying to give me more birth control? Hear me out. So birth control pills with estrogen, or just an estrogen pill, can help to stabilize the lining of the uterus a little bit. And so that can help decrease bleeding. Again, not a super long-term treatment. We usually do it for, a week, 2 weeks, 3 weeks to see if we can kind of stabilize things, but it can help. Again, not a long-term treatment, I hear you. So there are some newer studies out there in terms of treating irregular bleeding with medicines like doxycycline, which is an antibiotic, mifepristone, Celebrex, which is like ibuprofen. So we've got some things that we can try out there, but I hear you. Irregular bleeding can kind of suck. And if we try these things, or if you don't want to try them and you just don't want to deal with the Nexplanon anymore, that's okay, you can have it removed. Ideally, I tell people to try to give it 3 to 6 months or so to see if they'll tolerate it, but nobody should ever force you to keep it in if you want it out. If that's the case, you can always get another opinion. Okay, side effect number 2, and I kind of gave you a little preview, no bleeding. Okay, so actually no bleeding is totally okay. Remember, 20% of people with a Nexplanon will have no bleeding. It's totally safe, it's okay, and it's actually something that users really like, especially if people have had painful or heavy periods. In my opinion, Nexplanon is not the best birth control to get if your goal is to have no bleeding, but if that does happen, yay! If you want a scheduled bleed to know that you're not pregnant, and not having a period scares you because it means you could be pregnant, Maybe the statistic that it's 99.95% effective at preventing pregnancy can be helpful, but I hear you. If that's something you want a scheduled bleed, again, not the method for you. Third side effect, and one that I feel as a gynecologist, people are often the most concerned about, and that's weight gain. And I hear you. As a woman myself, I totally get it. So with the Nexplanon, I'm going to tell you a number of people who reported weight gain, but that's not the whole story, so stay tuned. So in one study, about 12% of people using the Nexplanon reported weight gain, but only between 2 and 7% actually had the Nexplanon removed because of it. However, I don't want you to think in your head, okay, 12% of people will gain weight. It's not the whole story, because when they looked at these people a year out and they compared Nexplanon users to people who were not using hormonal birth control and only the copper IUD, there was no difference in weight gain. Let me repeat that again. At 1 year, there was no difference in weight gain. So when people ask me about weight gain and birth control, I'm very honest and I say Depo is the only one that's associated with weight gain. However, if you got a Nexplanon placed and the only thing that changed, not your activity, not what you eat, not your stress, not anything else, was that Nexplanon, and you've noticed a 20-pound weight gain, well, yeah, I'm going to listen to you and I'm going to say maybe we should try and take it out. It's all about not always just relying on those numbers, but seeing the person in front of you. Take home message, I don't want you to avoid the Nexplanon because you're worried about weight gain, but understand that maybe it's associated. We don't have any good data, but I will listen to you if you tell me that you have that concern. Another side effect, acne. About 10 to 14% of people who had a Nexplanon placed reported acne, but very few had the Nexplanon removed because of it. And that's really because we've got lots of really good treatments for acne. And so we can partner with our dermatology colleagues and try to figure out a working solution. Again, if you want it removed because you are having trouble with acne and you've tried things or you just don't want it, you can choose to have it out at any time. There are some other side effects like nausea, breast pain, headaches. A lot of these are related to the progesterone that's in the Nexplanon. We do see those side effects too in some other progesterone forms of birth control. We can often talk about ways to deal with it, watching kind of what you eat, exercise, the occasional ibuprofen for a headache. But if these are just not okay for you, then yeah, we can totally say maybe we should try a different form of birth control. I hope that walking through these side effects has been helpful and seeing that we do have really good solutions for some of them, but at the end of the day, we will always listen to you, and it is always okay if you have something to say, you know what, I want to switch it up. Head down to the comments, leave me any questions or concerns that you have there. And the resources from Planned Parenthood and Bedsider I really like, so take a look at those. And feel free to follow on Instagram and TikTok, comment, subscribe, turn on the like button, all that good stuff. I hope this was helpful, and happy contracepting, and stay safe.